range in which they work the best, and the stronger it gets, the more likely it is to irritate the skin. For vitamin C, most experts agree that a concentration between 5 to 20% is what you need to get the desired result. Niacinamide works fantastically at 5%. And a trained professional is unlikely to administer anything higher than 10% of glycolic acid at their clinic. Unfortunately, I've learned this lesson the hard way. Have a separate face towel. Instinct may have you wiping your face with whichever towel you have in front of you, hand or body towel. But Dr. Lily Talakoub says that body towels can contain remnants of soap, moisturiser, fragrances and other ingredients that could potentially irritate the face and lead to breakouts, clogged pores, and even rashes. Dermatologist Sahal Shah adds that it is also a bacteria and cleanliness issue since bacteria, fungus, dead skin cells, oils and other debris can collect on the towel, Shah tells Allure, increasing the risk of infections, acne flares, and irritation. Don't leave sunscreen in your car. I love that we're all taking sunscreen reapplication more seriously now. But I'd be lying if I said I wasn't guilty of leaving the bottle in the car for convenience. Sure, it reminds you to protect your skin if you're out and about. But cosmetic chemist Dr. Michelle Wong says that heat builds up in a closed car, which can degrade and destabilize the sunscreen formulation. So no matter how much you apply, there's a chance you're not getting the amount of sun protection written on the bottle. Stick a travel-sized bottle in your bag instead. Acne isn't about hygiene. I'm pretty sure that everyone who has experienced moderate to severe acne has heard a comment about their hygiene at one point in their life. The next time someone says that you need to wash your face so it's clean, and your acne will go away, tell them that the connection between hygiene and acne is a myth repeatedly busted by medical experts. Dr. John Fournier says, acne is absolutely not caused by poor hygiene. In fact, washing the face too frequently or too aggressively causes the skin to dry out. Drier skin means your skin will produce more sebum to compensate, which could lead to more breakouts. Acne has a variety of causes ranging from hormones and genetics to dietary choices, over-exfoliating, and skin irritation. There's no singular cause for everyone with acne. And it's best determined by a trained medical expert, not the next-door neighbor. Hair loss is extremely common according to experts. The loss of anywhere from 50 to 100 strands a day is completely normal. However, telogen effluvium is on the rise, especially given the state of the world over the past 2 years. It's a stress-related condition where, according to Dr. Daniel Sugai, your hair goes into the sleep phase and falls out. This form of hair loss involves the shedding of more than 150 strands of hair a day, especially after a bath. It can last 6 to 12 months, sometimes longer. With stressor in our life, including COVID-19, job loss, grief, relocating cities, and surgeries, telogen effluvium can hit almost 3 months after a stressful event. Sugai adds that most cases resolve independently, and your hair will begin to regrow. If your hair refuses to grow back over time, you might have alopecia. Seek out a doctor's diagnosis for further treatment. Leave it to the professionals. When I started seeing videos of people doing at-home microneedling with a derma roller, I was tempted to pick one up myself to deal with deep acne scars. But the use of face tools, especially invasive tools such as blackhead extractors and derma rollers, is best left to the professionals to handle. I personally love microneedling for the treatment of acne scars, fine lines, wrinkles, pores, uneven skin texture and skin tone. But I strongly discourage the use of home microneedling devices, says dermatologist Jenny Liu, without proper sanitation and technique. Liu says there is a high risk of doing more damage to your skin and catching an infection that can potentially worsen your scars and hyperpigmentation. As someone with indented scars caused by some severe digging with an at-home extraction device, I wish I had known this sooner. Leave your cuticles alone. I'm a skin picker who constantly attacks her nails, and I feel bad for my cuticles. So I started trimming the cuticles to stop myself from picking at them. But it turns out that's not a very good idea. Cuticles protect your nail matrix. Trimming them or pushing them back disrupts them and can allow bacteria in, leading to a nail infection, says Dr. Amna Adel. The best thing you can do for your nails and cuticles is to keep your hands moistured. And if your cuticles are dehydrated, add a thin layer of Vaseline to your fingertips before sleeping to trap in some moisture.